Good morning and welcome, everyone. We appreciate you being here today for our next edition of the wonderful Wednesday webinar. We hope you are safe and well and enjoying hopefully a beautiful sunny day in your location here in Alabama. We have a fun little video to kick off today's webinar, which will kind of set the tone. And it is a couple of minutes, and that will allow some other people who are maybe logging in to have another minute or so to join us. So we're going to start with a little video that I hope you'll find entertaining and informative today.
Time to tidy up, tidy up, tidy up. Time to tidy up and put your things away. It's time to pick up toys, pick up toys, pick up toys. Time to pick up toys, put them in the place. Time to close your book, close your book, close your book. Time to close your book and put it on the shelf. Time to look around, look around, look around. Time to look around, does the room look clean? Make the room look nice and neat, nice and neat, nice and neat. Make the room look nice and neat, thank you very much. When you finish play, put your things away. Keep your room neat, nothing under your feet. Good to find a place to keep things safe, thank you very much. It's time to tidy up, tidy up, tidy up. Time to tidy up and put your things away. Thank you very much, thank you very much. Time to tidy up.
Well, I hope you enjoyed that cute little video just to kind of set the tone for today. We certainly are going to be talking about tidying up and actually more than that, cleaning, disinfecting, social distancing. Oh my, as you continue to either operate or prepare to reopen to serve the families in your community and your staff. We're delighted you've taken time to join us today. Again, I am Joan Wright. I'm Executive Director for Childcare Resources in Birmingham, Alabama. We serve Blount, Jefferson, Shelby, and Walker counties in central Alabama. We are a United Way partner agency and a child care resource and referral agency, and we do have a quality contractor contract with our good friends that are joining us today from the Alabama Department of Human Resources. We have a great lineup of speakers for you today, and before we get to them, just want to take a minute in case any of you are new today or haven't learned how we function on these webinars. You'll see to the right side of your screen there is a chat feature. We can communicate there. However, due to the time of the event and the multiple speakers we have, we will not be able to get to all your questions. We will try to address a couple of them on this event, and hopefully later on when we send out the recorded version, we can share some other responses and information resources with you as well. You'll also see there's a tab there that says polls just to the right of chat, and we are going to have some polls today that we hope you'll participate. It's just another way to engage our audience through this platform, and we're delighted that Voices for Alabama's Children provides this platform for us and is able to add these additional features for your engagement. And so as you see those pop up throughout today's event, we just ask you to take a moment just to respond to whatever answer most applies to you. We're just trying to gain some information as we prepare and share these sessions. The final tab you'll see is handouts, and several of our presenters have handouts they've added to today's event to enrich this experience for you and provide information you can refer to later after this event. This event is going to be recorded, and we will send out the recorded with all the attachments and links that were shared today for you to have as a reference later on, or to share with others, or to even have an in-service with your staff, whatever you see is most appropriate. So again, you'll see those features to the right of your screen, chat, polls, and handouts, and you click on them just like tabs on your screen when you're going through the internet and such. So that was just a quick orientation. Again, we're glad you're here and welcome. This is the second in a series of 4 Wonderful Wednesday webinars we're hosting. Next week's session will be all about community engagement and how you can take advantage of resources within your community and some other thoughts you may have about ideas to engage the community in your work. Today, we are focusing on cleaning, disinfecting, sanitation, and social distancing. We're going to start off today, as we have in the past, with our guests from the Alabama Department of Human Resources. We have several of them with us today. I'm Bernard Houston, who is the Administrator for Child Care and Workforce Development. Jennifer Cannell, who is the Division Director. We also have joining us today Stacy Sorrell, who is with licensing at DHR, and her counterpart, which is Candace Keller, who is over subsidy. So I've sent them some questions in advance of today's session, and I am inviting them now to come on board and join with us and share some opening remarks and hopefully address a few of those questions we sent previously. So welcome, and I'm glad you're here. We'll start off with DHR.
Can you all hear me now? Okay, thanks. Well, I am, again, want to express our gratitude for being invited to take part in the Wonderful Wednesday webinars. We thank you for that. And we are so excited to see childcare facilities starting to slowly trickle and reopen across the state, and we are glad to do that. So just want to remind everyone that we do have the map of open facilities on the childcare page on the DHR website. If you are a director or a childcare employee and you don't see your center on that website or your family childcare home, we would encourage you to contact us and let us know that you're open, so we can update the map. We want to make sure that everyone, we're keeping that map as updated as possible so that we can ensure that our parents and caregivers out there that need childcare are able to find that. So we did have a couple of questions from last week's webinar that were asked in the chat box that we did not get to address last week that we're going to address this time. So I'm going to go ahead and address the questions that concerned childcare licensing. I believe that Stacy Sorrell, who was trying to join us, is having some technical difficulties this morning. She's in our Birmingham office, and so she's not able to join. So I'm going to go ahead and address those, and then I'm going to turn it over to Candace Keller and let her address the questions related to our childcare subsidy program. So one of the questions that we received was, how do providers keep children 6 feet apart? And so we just wanted to update everyone and let you know that the social distancing mandate is from the state health officer's order. And so it's not a minimum standard that we are enforcing. It's not part of the minimum standards. And in the health order, it is a recommendation. It's not a licensing requirement. So we would really encourage everyone that wants to try to make sure that they can get that accomplished to go ahead and contact their health department and find out how they would like for you to do that. Additionally, on our website, we have some guidance from the CDC, and they also have some guidance on there about maintaining social distancing in child care facilities. You all to those resources. Another question that we had was, are there requirements to reopen childcare facilities, especially in light of cleaning supplies, masks, gloves, etc., being in short supply and the prices for what can be found having increased dramatically? So, you all are, childcare is a business, and so we all know that you all have to make your own business decisions in regard to whether you can operate or not. There are no requirements from DHR licensing regarding reopening, but the department will continue to enforce the state's minimum standards. So we do, require that you all use gloves for diaper changing, that you keep the facility clean. And so if you're not able to obtain those supplies, that would probably impact your ability to reopen, because all the minimum standards are still going to be in place. So it's just at the discretion of each business owner to determine their operational needs and determine if they can reopen or not. But DHR does not have any requirements about reopening. Another question that we had was, are providers limited to serving only essential employees in their programs? And the answer to that question is not from DHR. DHR licensing is not limiting childcare providers to serve essential workers' children at all. So that's not anything that is a requirement from DHR. So as long as you are maintaining compliance with the state health order, we are not, specifying who you may or may not serve in your facilities. And then the last question that really pertained to licensing in this that we got in the chat box last week were, are there any strategies for determining which families to serve with reduced capacity and with the 6-foot social distancing requirement? And DHR does not have any strategies that we are asking people to follow. It's going to be the decision of each provider and the business owner to decide if they're able to reopen and who they are able to serve, and how many they're able to serve, as long as they are in compliance with the health order. So wanted to address those questions with licensing, and then we had a couple regarding the child care subsidy program specifically. So I would like to allow Candace just to take a moment to answer the couple of questions that we got about that program.
Great, thank you, Jennifer. That is certainly valuable information, and hope that attendees take great comfort in the information you shared. I also just want to let everyone know that presenters do have the option of whether or not they want to be seen. So just because you're hearing them and not seeing them may not mean there's anything wrong with your visuals, and maybe they just selected not to be on camera today, which is fine. And it is lovely to see Mr. Houston with us today. Last week we saw Jennifer and heard Mr. Houston. Today we are hearing Jennifer and seeing Mr. Houston. So great to see you, like the bow tie. And now welcome to your screen, Candace Keller, and she will address a couple of questions regarding subsidy. Thank you so much. This is great information.
Good morning, everyone. Again, my name is Candace Keller. I'm the program manager for the Child Care Subsidy Program here at DHR. And just to go over a few of those questions that we had, will there be another update about paying for children receiving subsidy? On May, we sent out a notice to all subsidy providers on May 1st, and it addresses the sustainability payment. The sustainability payment is 50% of your children enrolled that are on the Child Care Subsidy Program. You'll continue to receive that until further notice. Now, that sustainability payment is to help with the decrease in the capacity for the providers that are open, and then also to help offset some reopening costs for providers who are closed. We also have providers that choose to open. They will be paid at the authorized rate for the children that they are serving. However, those children need to be swiped in and swiped out every day. That is no different than the requirement that we've asked for all our providers to do before COVID and during COVID. The children need to be swiped in and swiped out each day. Our payment policies for the absences has been suspended. We will not be paying for absences where children are swipe absences. We understand that there are a lot of children that are not attending. However, the sustainability payment is to compensate that as well for your lower capacity. Providers will not receive any payment for any closure days. The closure day system is set up for if you had 14 days, if children had been swiping 14 days prior to the closure date, and therefore we know a lot of providers have already closed, so they wouldn't be getting paid for those closure dates. And providers that choose to remain closed are only eligible for the sustainability payment. That is the only payment that we'll be paying to the providers who choose to remain closed. Another question was, are children on the subsidy required to be served? No, they are not. There is no mandate by DHR or the federal government that says that during this time their subsidy children are required to be served. So if there are any other questions, please let us know. Get forward those over to Joan or ask those questions in the chat box, and we'll be more than happy to answer them for you.
Great, Candace. Thank you. That certainly was wonderful information. And I know that these questions have been top of mind for many of the providers who may be on this event with us today. So for those of you that may cover multiple facilities, or maybe you know some other colleagues in your community, encourage them when the recorded version of this is sent out to share that with them, and also encourage them. DHR has been very receptive to their intake lines, managing your calls and questions. So please encourage them to reach out directly to DHR. That's the best way to get the right information, is to go directly to the source. So again, thank you so much to Jennifer, to Mr. Houston, to Candace, and Stacy, who wanted to participate today and unfortunately had some technical difficulties. So we appreciate you preparing your responses. Speaking of going straight to the source, right now we're going to go straight to the source from Jefferson County Department of Health. We have two guest speakers with us here today. I think you're going to be really thrilled what they have to share. They've got a lot of information packed into their presentation. So have your pens and pencils and paper ready. And again, please take advantage of the handouts tab as they present to gather some additional resources information. So first up, we're going to have Mr. Kevin Tolbert with the Jefferson County Department of Health. He is an environmental specialist there and inspector, and he will get us started, and you will see some things coming up on the screen that they have prepared for today's presentation. Thank you.
How are you guys
Kevin,
doing today?
take it away.
All right. I'm here today to do a quick slide presentation for cleaning, sanitizing, and disinfecting, and hopefully it will clear up some misconceptions and confusion that people have had in the past. They tend to lump those items together, and we're going to kind of go over it with you guys. Okay. Well, the first thing I want to talk about is the definitions of cleaning, disinfecting, and sanitizing, to tell you guys the differences. Can you guys see that on your screen? Yes, ma'am.
Yes, they should be able to see it, Kevin.
Cleaning refers to a mechanical process, scrubbing, using soap or detergent and water to physically remove dirt, dust, debris, and many germs from surfaces. So anytime you're wanting to do the cleaning and disinfecting, or cleaning and sanitizing, you want to make sure you remove any type of loose debris or dirt or grime before you start either the disinfecting or sanitizing process. Disinfecting is a little bit different. It refers to the act of using a process or chemical application to destroy pathogenic microorganisms, except bacterial spores. And the key to disinfecting is it's typically on non-food contact surfaces, things like doorknobs, light switches, desks, things of that nature. A disinfectant refers to a chemical substance approved by the EPA or the Environmental Protection Agency authority for use in the disinfection of non-food or non-mouth contact equipment and surfaces. So the biggest thing I want to delineate between that and sanitizing is that it's normally going to be used on non-food contact surfaces. Okay, sanitizing refers to a process that provides a required accumulative heat or concentration of chemical for the required time to reduce the bacterial and pathogen counts to a safe level for clean, and this is the main key I want to talk about, food contact surfaces or mouth contact surfaces, things like dishes, toys that can be reasonably assumed to be put in the kid's mouth, dining tables. That's what sanitizing is. You're going to use some sort of heat, and in most cases in a daycare, if you don't have a kitchen, you're going to use a chemical, and you're not killing the germs, you're reducing the bacterial pathogens to a safe level. And the final bullet point I want to talk about is sanitizer, which is a chemical substance approved by the EPA for use in the sanitization of food equipment and utensils and mouth contact surfaces. You guys have any questions about those terms? Okay, I want to move to slide 3, and it talks about cleaning surfaces. Like I mentioned before, you want to wipe the surface clean of any loose material. Clean the surface using fresh, warm water and either soap, detergent cleaners, and a cleaning cloth, and wipe the surface with fresh water to remove soap and other residue. Okay. Disinfecting surfaces. Now, if you're manually mixing a solution, and this is mainly talking about bleach or quaternary ammonia, you want to make sure that you have the necessary test strips, and we'll talk about that later on in the slide. I'm going to give you guys some examples and some pictures to look at. Make sure that when you're manually mixing the disinfecting solution, it shall be made daily and more often as needed. Some examples include Lysol brand disinfecting wipes, Clorox brand disinfecting wipes, bleach water solution using common unscented household bleach. And of course, the surfaces you want to make sure you're treating are the diapering surfaces, potty chairs, restrooms, and surfaces contaminated with body fluids. And on that page, you'll see an example of a disinfecting wipes from Clorox. Okay, next I want to talk about sanitizing surfaces. Here you want to make sure that when you're manually mixing, it's the same thing as disinfecting. You want to make sure you have the proper test strips, whether it's chlorine or quaternary ammonia. And some of the common EPA-approved sanitizers are a bleach water solution of 50 to 200 parts per million of chlorine bleach using common unscented household bleach. And those surfaces you want to treat, again, those are food mouth surfaces such as high chair table surfaces, dining areas, and toys having reasonable expectations to be placed in the mouth. Okay. Again, this just gives an example of, cleaning the surface before you apply the sanitizer. And the most important thing I want to stress to you guys is that whenever you're using sanitizer or disinfectant, you want to make sure you read the labels on the instruction on back of the item, and you want to make sure you follow the required strength and appropriate contact time because they're different for each item. And these are some examples of what you can use. Wiping the surface with a cloth or disposable towel soaked in an EPA-approved sanitizer solution. Surface application of an EPA-approved sanitizer solution from a properly labeled and approved spray container, or submersing the articles in an EPA-approved sanitizer solution. Okay, this slide here gives you the website where you can look up all of the EPA-registered disinfectants, and the human coronavirus, SARS-CoV-2, the cause of COVID-19, is on that link, and it will give you instructions on how to read an EPA label. And these are just some examples of the different types of pathogens and, what you can use for each one of those.
And again, if I could just interrupt momentarily, Kevin, this is great, fantastic information. Again, audience, you're seeing some information he's sharing on the screen, as well as to the right, there are handouts. You can click the download there to download those handouts. Again, we will be sending out all this information again post-event with a recording of today's session.
Okay.
Thank you,
and now we're to the picture presentation. I want to give you an example of Clorox. When using Clorox, you don't want to use scented or splashless. Splashless is normally used in when you're doing laundry, and they're just not effective as the regular unscented bleach. Now, in the past, we all had the 5.25% chlorine bleach. The proper name is sodium hypochlorite. And you want to make sure you read the label because you have now 6% and 8.25%. And the different concentration times and application methods are going to be different. So make sure you read those properly. Okay.
And of course, as always, keep all of these
children.
chemical products out of reach and out of the mouthing opportunity of children. Definitely keep them secured and tightly sealed.
This page here is really important. I want you guys to really pay attention to this particular slide. This is how to manually mix bleach and water together. Obviously, we're using the standard 5.25% sodium hypochlorite. When you're doing sanitizer for chlorine, those are some examples of the test strips. You want to make sure you do 50 to 200 parts per million. Again, it gives you the examples of food and mouth contact surfaces, and it gives you the instructions of how to apply it at that concentration. One thing about the sanitizer strength, people may ask, well, what is the contact time if you're applying that through a spray bottle or a bucket or what have you? And that would be 30 seconds. Typically, you're going to find that in the sanitizing compartment. If you have a kitchen, that's going to be your last step, and 30-second contact time for dishes or any food mouth contact surfaces would be the time. When it comes to disinfectant, you're going to need a certain type of high chlorine test strips for that. You'll have to order those. That one, you're going to go up to 400 to 800 parts per million. And those are going to be for diapering areas, restroom surfaces contaminated with body fluids, as stated before. Let's go back to that one. People ask, well, how long do you leave the manual mixing in the spray bottle? You want to do it daily or more often than it's needed, so it doesn't break down and loses effectiveness. On this page here, this is specifically for coronavirus. It tells you the disinfecting strength. And this would equate to a little bit more than the 400 to 800 parts per million for your body fluids and diapering areas. You're going to be about 1,000 parts per million of chlorine bleach concentration. The first one is for a gallon. The other one is for a quart. Okay. Quaternary ammonia, which is another commonly used sanitizer in food establishments and daycares. You want to make sure you follow the instructions. Typically, it's going to be 200 parts per million for quaternary ammonia when used as primarily a sanitizer. You want to follow the instructions as stated on the back of the container. And these are some examples. You have the liquid, and then you have the little tablets. You'll see those most often in like gas stations and concession stands. And those are the test strips to the right of that you can measure the proper concentration. Temperature is going to be very important with quaternary ammonia. You want to be mainly room temperature when you're mixing those. Also with bleach, you want to make sure you use cool to lukewarm water anytime you're applying a bleach water solution. Okay, so the last part of the presentation, we just have some slides I want to run through really fast. I want to give you some examples of some types of disinfectant and sanitizer. This one here is Odoban. You see that commonly in a lot of the daycares. It is used primarily as a disinfectant, but you can also see it's used as a sanitizer, deodorizer. Make sure if you're going to use these products, you follow the manufacturer's directions because you have different contact times and application methods. And as you can see where it has disinfection and sanitizing marked. Also, too, with all of these products, you want to make sure that they all have an EPA registered number. And as you can see to the left, we highlighted all of these products are going to have an EPA registered number, so it will allow you to use that in your establishment, whether as a disinfectant or a sanitizer. Okay, next slide here is called Shockwave. It's a disinfectant, and you can see where you can use it as a disinfectant or a sanitizer in the boxes that are enclosed around it. To the right, you'll see it has an EPA registered number circled in red. Okay, this is a common one in daycares, and this is going to depend on the director's money situation. Some of these may be a little cheaper than others, so you're going to do what's best for you, but all of these are approved. The disinfecting wipes, you have different brands, Clorox, Lysol. You can even use the Sam's or Dollar General brand. You can see where to use it as a disinfectant, you got to leave it on there for at least 4 minutes. You can't just wipe it and then leave it. As a sanitizer, which I would actually recommend using these items primarily what is stated on the front, even though you can use it as sanitizers or deodorizers or what have you, but make sure you follow the label manufacturer directions. You can see at the bottom in white is circled the EPA registered number again. Okay, this is another one. This is great for those establishments that don't have a kitchen and they don't want to use bleach. It's called Clorox Anywhere Hard Surface Spray, and if you notice, it's specifically a sanitizer. It has the direction for use as well as the EPA number at the bottom, and this requires a 2-minute contact time. Okay, this one here is called Pure. This one is commonly used by the grocery store Publix. They use this a lot for disinfectant. And if you look there on the box that's enclosed around the different pathogens, Most of them are 30-second or 2-minute contact times. Also, it has an EPA registered number listed to the left. Okay. Disinfectant spray, the aerosols, same thing. You want to follow the contact times. If you notice, for those different pathogens, 10 minutes is common on a lot of those. Some of them are 50 seconds. So again, the main theme is to make sure that you guys focus on the directions.
Great, Kevin. That's fabulous information, I believe. Great, Kevin. That's fabulous information, I believe. Cecilia has some additional
Yes, ma'am.
comments
I will
about
pass it
social
over to Miss
distancing
Cecilia. You
share.
guys have a great day.
Thank you.
All right.
Great. Thank you.
Good morning, everyone. Once again, I'm Cecilia Nix, and this is just going to be
Morning.
a quick update about the social distancing and what we are trying to do with that. If you have seen the order states that social distancing is something that we are not enforcing. It's just something that we are recommending. And for the daycares, we are strongly recommending that you do the 6 feet social distancing. So, as a requirement for that, we want to make sure that you are trying to keep those children as safe as possible while they're inside of your facility. Other things that you may have seen would have been an ordinance from the city of Birmingham that stated face coverings. That was something, like I said, that was an ordinance from the city of Birmingham. You just have to follow up with the city of Birmingham's and see how they're requiring the facilities to maintain that. I think it's, once again, just a suggestion for those children, if the parents or the daycare facility has or is trying to make sure that they have coverings, but not a requirement. We also had some questions about when this order would end. Once again, that order does not end until the 15th, but any type of preemptive information that comes in will be updated as soon as possible. So we just want to make sure that everyone knows that these are things that were put into place by the state health officer, and those are things that we are following. Once again, you can also, for your facility as a director, you can be more stringent inside of your facility. You just can't be less stringent. So you just want to make sure that you keep your children as safe as possible, as well as yourself and your staff.
Great, Cecilia, that's fantastic. And again, just to reiterate for everyone on the event today, while we do have these great speakers from Jefferson County Department of Health, they are speaking to the Alabama Department of Health order that is in place. So what they've shared with you today is applicable to the entire state. We just happen to know them very well and partner with them on many things. So we were glad to be able to have them to join us today. Well, the next, thank you again, Kevin and Cecilia, for your great information for preparation for today. I learned a lot, and I hope that many of you on today's call did as well. We are now moving to our final speakers of the day, and really want an opportunity for you all to hear directly from some child care providers who are actually open and dealing with these cleaning, sanitizing, disinfecting, and social distancing, and what does that look like in the real world. So first up is my friend Barbara Trawick with the Levitt Jewish Community Center. She is at the Cone Early Learning Center there. She has actually been open since March 18th. They started out serving just essential employee family members, and now they, I believe, are reopened. And then following her is another good friend of mine, Donna Blackburn, who is director at UAB Child Development Center, who just recently reopened. So both of them are dealing real world with the practices that you heard shared today. So Barbara's going to talk a little bit about what that looks like for her center with regards to the cleaning, sanitizing, and disinfecting, and Donna's going to talk a little bit about the social distancing. So Barbara, if you'd go ahead, please. Thank you so much for joining us.
Sure, of course. Good morning. So like Joan said, we have been open since March 18th for essential employees. It's been pretty slow. We've had a very few number of children, so it's been good for us to sort of ease into the cleaning and sanitizing in a way that helps prevent the spread of the coronavirus, because while we had been doing those things as part of our daily life, this is just a little bit different because it means so much more. So we have, obviously, when you come in the morning, we wash our hands. We don't let the parents do not come into the building. We meet the children outside at their cars. We take their temperatures. We ask their questions. We bring them in the door. We wash our hands. We wash the children's hands. The teachers wash their hands. So there's lots of hand washing going on. Then we have a cleaning log. So every 2 hours, we have to disinfect all the hard surfaces. So getting the right chemicals was hard at first, but we've managed to garner enough bleach and disinfecting solution. And someone comes in and mixes the bleach first thing in the morning, and the teachers have a log where they disinfect all the hard surfaces every 2 hours, and they have to mark it off. We still have very few children per classroom. We've limited the number to much fewer than the health department recommends because we know that social distancing is important. So that gives, we also have 2 teachers in each classroom. So that allows someone to do the cleaning while someone's doing the teaching. So every 2 hours we sanitize and clean all the hard surfaces and we check it off on our list. The toys in the classroom, we've limited the number of toys we put out so that once the children play with them and then they leave them, they can be removed from the area and sanitized. And then something else can be put in its place while those things air dry. We also have, we've no playground time. We do not go outside on our playground, but we're fortunate that we have the soccer field, we have tennis courts, and we have a walking trail. But we have, anything we take outside that's not for use in your own classroom, like the bye-bye buggies or the hula hoops or things like that. Each class has to sanitize them individually before they bring them back in. And it sounds like a lot of work, but because we have so few children and enough staff, we feel like we can sort of get into a rhythm, get into a groove, so that as we add more children, we're not scrambling to keep up with the cleaning and disinfecting.
Great, thank you so much, Barbara. Really appreciate that. Donna, before we get to you, Donna, we did have a couple of polls for today. So if that's something you can put up real quickly before we get to Donna, some of our polls, Angela, if you could put that, and for those on the call or on the event today, if you look at the polls tab, you will see those polls pop up here momentarily. You can just respond from your own devices. So right now we're asking how many of you are currently open. And again, just as we asked this question last week, the overwhelming majority of you are still closed. And the next poll is just asking kind of what region of the state are you representing? So there's some choices there for you. And then do you have any plans yet to reopen, and if so, when? So still, again, the vast majority of you are unsure. So thank you so much for participating in those polls. I'm gonna now invite, you can continue participating in them. If you didn't get to respond yet, you'll see them there in the polls tab. You can still submit your response. So Donna, talk with us a little about how you all have been managing, particularly the social distancing aspect in your operation.
Well, I started with a social distancing plan that I wrote up to turn into the health department. But the biggest part of it is making sure that the parents are all aware of it, so they understand that they will not be allowed in the building, and that each room's capacity is limited to 8 children. And so while we're not making children sit in separate corners, we do try to do independent activities so that they're spaced apart around the room. And at nap time, we do sleep them 6 feet apart. So it's really hard to keep the young children apart from each other and apart from the teachers, especially infants and toddlers. So while we can't necessarily do 6 feet there, we just make sure that every teacher washes their hands between every child. And of course, the normal hand washing that we do as they enter the building, anytime they touch body fluids, every time a child puts something in their mouth, those kinds of things. But the biggest part is making sure that you're staggering your pick up and drop off, so we're not all crowded at the door, bottlenecking, because the exact same teachers have to pick up and drop off from the curb. And that is so that your teachers that are in the building are not cross-contaminating between classrooms. I think staffing that has been one of the biggest challenges, because that means every room has to have 2 teachers and their own break person if they can't break themselves. And that person can't go break several rooms. They can only break 1 room. So that's another added staff member. And during the day, we have little signs in the break room and the hallways and all the public areas to encourage the staff to use social distancing. But for the children themselves, we kind of redirect them if they're wrestling or hanging on each other. But the reality of it is they're in the same room together all day. So you can only encourage it to the point that it becomes detrimental to their psyche, their mental health. The children are coming in more anxious than they were before, and we are serving essential employees, so we have children who we've never had before. So there has to be some comforting there, and the only thing is we distributed masks to all of our staff, and we asked them if you're going to be holding a child or if you're going to be in close proximity to a child that you wear your mask. So everybody got a cloth mask, and then they're free to have more than that, but we made sure that everybody had at least one. There are no children wearing masks in the program. And I don't even know if we could get them to do that. So even with us wearing them, they're not saying, oh, can I have one? The biggest thing, though, is making sure that the parents understand that there's going to be a stricter sickness policy and that they're not going to have interaction with their teachers. Each day when I take them to the curb, some of the parents, even though we have an app that sends updates, they want to know when can they come in, when can they see their teacher, when can they see the classroom, and that's just not going to be an option at this time. It's not possible anymore. So beyond that, I think the biggest part is just making sure that everybody's on the same page, that we are going to encourage the distance, but because we're working with children, we don't want to get to a point where we're saying they all have to be sitting in separate corners, because then they're going to be in the isolation stage, which we don't want that at all.
Great, Donna. Thank you again. So those of you that have been participating today, just wanted to give you sort of some kind of boots on the ground, real world application of what all this looks like from a provider perspective, and hopefully you found some helpful, useful information there. Again, the last thing any of us in childcare want is to have detrimental effects on children. And while these requirements and recommendations are challenging, it's going to require all of us in caregiving roles to be more creative, to be more flexible, be more adaptive, to ensure that we're still providing safe, nurturing care for children. Because again, they, as Donna indicated, they're already coming with more stress. They don't necessarily understand everything that's going on, even at a very young age, but they can sense the change in routines, the change in interaction, the change in opportunities for play and such. So being very creative with songs, being very creative with play areas, making sort of fun with having to, stay apart. Simon says, let's get a little further away from our friends. So trying to find fun, child-friendly ways to enforce these new recommendations and some are requirements in your facilities. Well, this brings us to the end of today's session. And again, just want to extend a great appreciation to all of our presenters today, all of you in the audience that took time to join in today. We want to thank Voices for hosting. Unfortunately, they are not able to host our last 2 webinars, so you'll be seeing a different format for that. So stay tuned in your inboxes, and other ways we've been promoting this through social media, or sometimes Facebook groups are promoting these. Whatever way you're getting this information, just know it's going to look a little different for the last 2 sessions. And next week's session will be around community engagement. We have some great speakers already lined up for that. And we're also going to talk about advocacy. How can you lift your voice in these challenging times to be sure that your community can hear you, your local, state, and federal elected officials can hear you as well. So thank you again for joining us today. Continue to do your research to make determinations on what is best for your business and your staff and your families. Thank you again. Have a wonderful Wednesday. Bye-bye.